It is Colon Cancer Awareness Month. A new report shows adults across the U.S. are being diagnosed with colon and rectal cancers at younger ages. Now, 1 in 5 new cases are among those in their early 50s or younger. Joining us live this morning is Dr. Suhail Salem, gastroenterologist at Dignity Health Northridge Hospital. Good morning. Thanks for joining us.
Good morning. Thank you for having me.
So regarding this new report, what might be behind patients getting diagnosed with colon cancer at a younger age?
Well, it is an area of ongoing research, and there has not been a singular explanation that explains why people are getting colon cancer at a younger age. What we do know is that there has not been any increase in genetic disorders causing colon cancer, and that it is likely something in our diet, lifestyle, or environment. We have seen an increase in rates of diabetes and obesity over this time frame, which are both risk factors for colon cancer.
And what are the early signs that people should watch out for?
Well, the potential symptoms of colon cancer are symptoms like rectal bleeding, abdominal pain, changes in bowel habits, but also the earliest stages of colon cancer and the precursors to colon cancer don't cause any symptoms at all, which is why we're placing such an emphasis on screening and prevention. If we wait until symptoms develop, then chances of it being diagnosed at a more advanced and less treatable stage are increased.
And you mentioned some of this as people are watching this morning, they wonder, okay, is this something that, could happen to me? Who is more at risk for being diagnosed?
People that are at increased risk are those with a family history of colon cancer, especially in a first-degree relative or a chronic medical condition such as inflammatory bowel disease. But at the same time, I want people to understand that this is really a disease that everyone is at risk for, and upwards of 70% of colon cancers occur completely sporadically, meaning there is no family history at all. So just because there's no family history or you don't have one of those medical conditions, I don't want people to have a false sense of security that they don't need to get screened.
Yeah, certainly concerning. Okay, on that note, are there any preventative measures that we can take to prevent or reduce our risk?
Yes, so a healthy lifestyle can help reduce your risk, such as things like regular exercise, eating a diet with lots of fruits and vegetables and fiber, avoiding smoking and excessive alcohol intake, and reducing or limiting intake of red or processed meats, sugary drinks, and high temperature cooking like barbecuing can potentially reduce your risk, although no lifestyle measure alone will completely prevent colon cancer, and that's where colon cancer screening programs come in to fill that gap.
Okay, so when is the right age to get screened for people who may be overwhelmed about that process? Any guidance or reassurances to offer this morning for them?
Yes, so everybody should begin screening for colon cancer at age 45, and those with a family history should begin at age 40 or even potentially younger, depending on their family history. And especially if anybody's experiencing any symptoms like we discussed, they should talk to their doctor about getting a colonoscopy at any age.
Okay, Dr. Suhail Salem joining us this morning. We appreciate the insight that you offered this morning. It's obviously incredibly important. Thank you again.
Thank you.